Okay, hi everyone, welcome. My name is Travis SALWAY. I use he, him pronouns. I am on unceded Coast Salish territories, specifically those belonging to the Musqueam, Squamish, and Tsleil-Waututh nations. And I'm an uninvited guest here. Really grateful to be here with so many fantastic colleagues during Pride Month to talk about resilience in queer and trans and two-spirit communities. I'm going to start off by saying that we're all together as part of a group called the 2SLGBTQ Roundtable, and we're a group of queer and trans and two-spirit community leaders, activists, researchers, practitioners, all of whom care very much about health equity for the communities we serve. Let's have all of our discussants introduce themselves, and we'll start with AJ.
Thanks, Travis. I'm AJ Lowik. I use they, them, their pronouns. I'm just a few months away from defending my PhD with the Institute for Gender, Race, Sexuality, and Social Justice at the University of British Columbia, which is also located on the ancestral and stolen lands of the Musqueam, Squamish, and Tsleil-Waututh Coast Salish peoples. I'm also the Gender Equity Advisor for the Center for Gender and Sexual Health Equity. And my primary passions are actually reproductive health and reproductive justice. So those are very much connected to mental health and substance use topics, which I know we're going to be talking a lot about today, but reproductive justice is really where I feel most at home.
Thanks, AJ. So glad you're here. And Jay.
Hi, everyone. My name is Jay. My pronouns are they, them, Negum in the Mi'kmaq language. And I am calling in from the unceded, stolen, and occupied territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And so I am a public health and preventive medicine resident, including family medicine at UBC, as well as a MPH student at School of Population and Public Health at UBC, doing my practicum at MindMap BC with Travis. And my passions in health equity are particularly around access to safe and affirming care, particularly for two-spirit folks, Indigenous queer folks, other queer and trans folks, as well as the Indigenous community at large. I am mixed Mi'kmaq and settler from the island of Okanagan, which is colonially known as the island of Newfoundland.
Thank you, Jay. And now MILO.
Hello, everyone. Hi, my name is MILO OFFEREIN-ALDER, and I'm the coordinator of a transgender wellness program for the East and West Kootenay region called Trans Connect. And it's a program through Ankors, which is the local AIDS organization. I live in Winlaw, which is the unceded territory of the Sinixt First Nation, who are not extinct, though they previously have been declared so by the Canadian government. And my programming is regional. And so I also work on the Tanaha, Kindastet, and Selix First Nations territories as well. And my pronouns are they and them. Oh, one more affiliation. I'm a board member for Options for Sexual Health. And that's a provincial sexual and reproductive health organization across BC.
Welcome, MILO. And next we have ANOOP.
My name is ANOOP GILL. I'm the co-executive director of program services here at Community. She, her are my pronouns I use. I went to the Faculty of Health Science, so I'm happy to be back. Part of my passion is to make sure that there is diversity in the many programming that are happening at Q, mostly happening through our seniors, youth, and counseling services. Part of my passion is to have femininity and masculinity emerge in our leadership roles and to honor that in a value add to many organizations from a community-centered approach.
Wonderful. And thanks for sharing your experience as an alum, ANOOP. That's fantastic to have you back. Next, we have Brittany.
Hi, everyone. My name is Brittany Clark Wakefield. My pronouns are she and her, and today I'm joining you from the unceded traditional territories of the Coast Salish people, specifically the Kwantlen and Semyamu nations. I am an uninvited guest and come from English, Scottish, and Irish ancestry, and I self-identify as a queer woman. I work for Carrier County Family Services as a mental health counselor, and I'm also the co-creator of a program called Nanki Nes Lune, Our Two Spirits, which supports two-spirit LGBTQ plus individuals that not only reside in Carrier County territory, but also throughout British Columbia. It's an online program, so there's a big piece about accessibility, which I'm sure we'll talk about later. And just thank you so much for having me.
Thank you so much, Brittany. Glad you're here. And last and certainly not least, Gwen.
Hi, everybody. My name is Gwen Lister. Happy to be here. I use she and they pronouns, either or. I am an uninvited guest on the Musqueam, Squamish, and Tsleil-Waututh Nations, located in Vancouver, and I work in a couple of places. So I'm a concurrent disorders counselor at Vancouver Coastal Health, and I work at Three Bridges specifically. So most of the work that I do is with queer, trans, and two-spirit individuals. And then I also am teaching intro to sexuality, human sexuality and behavior at Langara, which has been such a delight for the past year. Interesting thing. And then my passion is really about how can we kind of tailor services to meet the unique needs of queer, trans, and two-spirit folks, especially when it comes to recovery from mental health and substance use. And then also just kind of like when it comes to research, just really elevating voices of people with lived experience. So that is me.
Thanks, Gwen, and thank you all for generously introducing yourselves and for acknowledging the lands where you're joining us. So now we're going to get started with a discussion, and we've called together this fantastic group of bright thinkers and engaged activists because it is Pride Month, a time when we remember the historic advances of trans and queer two-spirit people who came before us and really set the stage for us to think about new ways of activism and equity. It is also Indigenous History Month, so really wanting to take time to reflect on that intersection of indigeneity and queerness, transness, two-spirit positions and identities. And so, yeah, we're just really thrilled to have you all here. I wanted to start with a quote by Bayard Rustin. For those of you who don't know, Bayard Rustin was one of the principal organizers of the March on Washington in the Civil Rights Movement in 1963, and was also a gay man, although he was asked to kind of hold back his gay identity owing to homophobia in the Civil Rights Movement at the time. And he said, "We need in every community a group of angelic troublemakers." So these are our angelic troublemakers. And I say that very lovingly. I think troublemaker kind of has bad connotations, but I think troublemaking can be a very good thing. And in that spirit, what we want to talk about today are kind of two topics, and each of the guests will have a chance to comment and reflect on this in the context of their own work. First, we're going to think about the COVID-19 pandemic and really try to think about, although it has created hardship, what are some new opportunities? And I'll ask each of the guests to share an example of how two-spirit and LGBTQ people or the services that reach us have become stronger over the last 18 months, stories of resilience. And then in the second part, we're going to think about what two-spirit, trans, and queer people can teach the cisgender heterosexual majority about the power of gender and sexual diversity, and maybe offer some actions that our cis-het allies can take to support the education of other cis-het people as they work against the systems of oppression that affect us. So with that said, let's start with our first question. What is an example of how 2SLGBTQ people or the services that you work with have become stronger over the last 18 months? And I'm going to ask AJ to start us off. Thank you.
Thanks, Travis. So the things that is top of mind for me is the increased availability of no-test telehealth medication abortion, which might seem like an unconventional choice, but because I frequently wear my reproductive justice hat, I think a lot about queer and trans people and access to abortion. So we've seen a shift in the pandemic towards telehealth medication abortion, where someone can access the doctor through a telehealth appointment, can have their gestational age assessed without ultrasound. So using a variety of techniques, we're actually really great at dating people's last menstrual periods, which is something you need to do for the efficacy of medication abortion. And then someone can just go to their local pharmacy and pick up the medications. And this has been a really wonderful advancement to see kind of building momentum because of access challenges presented by the pandemic, because being able to have folks access abortion where they are is huge, not only for queer and trans people, but for anyone who's living remotely or rurally, anyone who experiences access challenges to abortion. So I've just been really excited by the prospect of having more folks kind of be in control of their abortion journeys without having to go into what is typically a highly gendered and heteronormative space, a space that is typically within an urban center, so that presents these kind of traveling-based inequities, and a space that is kind of really highly medicalized in a way that might present barriers for folks. So just really thinking and grateful for the increased availability of these no-test medication abortion options, and dreaming of a future where there's more options for abortion access for queer and trans people.
Thanks, AJ. That's really encouraging to hear, and is something that I hope inspires providers and administrators to reduce even more barriers that keep people from accessing much needed abortion services. So thank you for sharing that. Jay, would you like to share an example of resilience or strength in Two-Spirit LGBTQ people or services that you've seen over the last 18 months?
For sure. Thanks for the question, Travis. I think one of the things I've seen that has been the strongest in terms of demonstrating resiliency for our Two-Spirit queer and trans community is the increasing community connections over large geographies throughout the pandemic. So prior to COVID, a lot of services that were offered in person were all very centered around the Lower Mainland, specifically Metro Vancouver. And so a lot of these community gatherings and connection opportunities have gone virtual, which have allowed them to go provincial in terms of offering access to services. So two that come to mind for me that are near and dear to my heart is Trans Gathering, which is actually a program from ANOOP's nonprofit community. And that's been a way for me to really gain connection to the trans community here in BC after moving here last year. And the great connections people can make from all over what is now known as British Columbia, because we have people joining from the interior, the island, the northern region, and other places, even internationally, people who are planning to move to this territory. And also Two Spirits of BC, a program from Four Feather Society, have been able to create a really great opportunity to create a talking circle for Two-Spirit folks to come together and share their experiences from all over British Columbia. And I know last time I attended, we've had people come from like rural parts of northern BC. So it's really great to have the ability to connect people over such large distances. Because growing up in a rural community myself, I know it's very isolating and distancing to be a Two-Spirit queer or trans person in a small town where there's no one else like you. So being able to find that connection, even if it's virtually, I think is a really great source of strength and resiliency for our community.
Thanks, Jay. Definitely a theme of the forced connections online becoming opportunities for actually taking down barriers to services. So now over to you, Milo. What examples of resilience and strengths do you have to share?
Thank you. Yeah. No, two things really popped to mind when you asked this question. One, very similar to what Jay was sharing. In my work, one of the big cornerstones of programming that TransConnect does is a peer group called Gender Outlaws. And up until March 2020, these groups were happening once a month in various small towns through the region that I work in, right? And there's a really frequent feeling that I have noticed in people that I work with in my area, feeling like you are the only person like you in your whole town. And a lot of time that feeling is very founded in reality, right? And so I had the privilege of being able to see like, oh, only an hour away from you lives someone I think that you would really make a positive connection with. And yet there's this geography that's separating. And so when this peer group moved online, not only were people from different towns in our region able to be connecting, but it went from once a month to once a week for everyone. And so the consistency of connection has been really huge for a lot of people. And I've noticed as well in a lot of the rural areas that I work out of, a lot of trans people, for various reasons, choose to be stealth. And so that was a barrier as well to accessing in-person peer groups, right? The stigma of feeling like, oh, who's going to see me walk into that building, right? And yet online, so many of these stealth people are coming and connecting in with community. And that was even really a teaching for me, where maybe if I had assumed, oh, you know, such and such person maybe doesn't want to connect with community, I've come to a deeper understanding of the need that's there, right? So that really stood out to me. And the other one, which I have been really just kind of astounded by, is that for whatever reason, various rural divisions of family practice, so like GPs who are working in different rural areas, have over the last year really taken a look at gender affirming healthcare and how it is functioning, or I could say not functioning, in various parts of our region, and have decided to be starting task forces and action groups and be taking a lot of that leadership on. And so there's been so many more GPs and other people working with divisions who are really prioritizing gender affirming care, and even like specifically taking a look at youth and how there's so many gaps in trans care for youth, especially in our rural areas. And so that has just been so heartening to see happening. And I'm not sure why that's happening right now, but it is. And I'll have to ask some sociologist as to why.
Thanks, Milo. That's so great to hear. And I feel like you're already starting to plant some seeds for our second discussion about what our cis-het allies can do. And it sounds like, you know, although we wouldn't want to paint too rosy a picture of the healthcare system, you're pointing to some really positive advances in where, for instance, GPs are stepping in to the role that they need to play in providing access to gender affirming care. That's so wonderful to hear. So now I'd like to invite Anoop to share some examples and stories from her position at Q.
Thanks, Travis. I'd like to first acknowledge that COVID-19 has impacted our Indigenous communities differently. You know, when we thought about travel bans and restrictions being implemented, a lot of the work was done to protect our communities, especially Indigenous communities, around the spread of COVID-19. That also meant that resources looked very different for Indigenous communities, especially as we thought about inoculation and mask resources. So I will acknowledge that COVID-19 has had a very different impact on our Indigenous communities. In terms of resilience, one of the first things that community noticed was like a resurgence of innovation. We had, for the first time, youth on Zoom having these very elaborate movies that they were making and recording them and sharing it amongst each other, or opportunities to connect around Facebook platforms and Instagram. And youth have this, you know, ear to new language and excitement that they also were able to share in these intergenerational conversations with our seniors, because that platform was so robust to bring many parts of our queer communities together. And as we think about equity, I think Jay had mentioned before, is COVID allowed us to share the multitude and expansive resources that we have for our queer communities in our metropolitan area with our rural communities, and also allow for those rural communities to share their feedback and experiences that they had, which allows, from a program development standpoint, a better understanding of how to reach our provincial mandate. So COVID-19 gave us lots of opportunities to gain further knowledge about the many communities that we hope to continue to support. In terms of seniors, one thing that we notice is our seniors before never wanted or were invested in the capacity of technology. But when mobilized, when provided, you know, opportunities with smartphones and tablets, because their need to want to connect with their queer community was so important and part of their mental health and part of reducing social isolation, they created new skills with help of volunteers remotely. They were able to create new communities on platforms I've never seen. And we offered a spring fling, which was a party for our seniors. And they showed up in pairs and in safe couplings in any way that they could, just to celebrate what queerness looks like with seniors. Last thing, from an agency perspective, COVID allowed a surge of new funds to community organizations. I wish that, you know, many funders would give queer-based community centers like ours money abundantly, but with the umbrella of COVID-19, we got a surge where we could provide seniors with tablets. We could think about advisory groups and honoring peer honorariums, a capacity that had never existed before, we were now able to do.
Thanks, Anoop. I love all of those examples, and I've been hearing a lot, both through research we've done at SFU and from members of the Roundtable, that trans and queer and two-spirit people have really felt some unique pressures during the pandemic, because previously we may not have felt comfortable with our families of origin or in the same kind of family structure as our cis-het peers. And one of the effects of COVID has been kind of a loss of spaces of gathering. And so I love hearing, the kinds of things like the Spring Fling and some of the online connections that have managed to fill that really important need. So I'm really encouraged by that. Now over to Brittany.
Thank you. Yeah, without trying to echo too much of what my colleagues said, which are such wonderful things that have really strengthened us. The accessibility of services has been huge, especially coming from providing services to more rural communities where, lots of resources are in our urban centers, and now they're able to reach our more rural cities without our community members having to uproot and leave their community. So, the comfort, that confidentiality within staying within our own home or continuing within our own communities up in rural areas, we're finding that sense of community through these online platforms, and hopefully we'll be able to establish more, in-person or solidified resources up in the north, for example, or in our rural communities throughout the province. I think that's been a really big piece, just kind of thinking about with the lack of maybe representation in some of these communities, or not known representation of these communities, of having people who are questioning their gender or sexuality being able to actively listen on a peer support group and have their camera off and learn about queer culture and history without maybe sharing their identity, or connecting with someone through texting and not having that, and having that anonymity of who they are. It's been quite incredible, and just the creativity that is coming from local service providers and community members of making these adaptations through these difficult times has been incredible. I think of just some local services in what we know now as the Prince George area of gender outlines and queer cafe, where there's online book clubs like MILO said, or movie nights, but just connecting with people who may be in the next community over, but just reflecting on the Carrier County territory, it's 76,000 square kilometers in itself. So yes, you're in a similar territory or nearby per se, but it's still quite the large landscape. And we want to keep our community members in community. We want to bring these resources to them, whether that's through a virtual sense, which seems to be beneficial, or and then continuing to access these grants and other resources to implement the services in the communities as well. Thank you.
Thank you so much, Brittany. And now over to you, Gwen.
Thanks, Travis. Thanks everybody for sharing. I'll just, just kind of add my 2 cents in, because everybody already mentioned so many awesome things. I think an important part of what people are talking about of having virtual spaces to meet and then being able to extend programming, I agree, is really important. And I also just want to hold space for how that took creativity as well. And so, as providers that we all are, and as in whatever role we are in, not only does it take courage to kind of connect that way with new people virtually, but a lot of times it takes some ingenuity to be able to figure out, okay, how can I create a safe space online that people will actually come to over and over again? And so I just want to give kudos to everybody who was able to do that. And then in my position as well, just with the work that I do, which is one-on-one counseling as well as groups, my coworkers and I, we really just kind of had to take the same route and challenge to be okay, well, some people still need services in person. So how can we prioritize that, along with, introducing all this new telehealth technology and making sure that we're using it effectively. And I think that in the beginning, there was a lot of maybe anxiety around it, but yeah, I think that I can really speak for at least my experience that, people kept coming to groups and kept coming to counseling when we weren't sure if that was going to keep happening. And so despite, the dual pandemics that we talk about, like COVID-19, but also substance use, and I'll just throw in mental health, and sexual health in there as well, because they all seem to go together. You know, I think that there's a lot to say for how people kept engaging in care and not losing hope, which I think was a really easy thing to do, especially in the beginning, and as we had to start isolating. And so I think that I feel fortunate to have been able to witness a lot of strength within the queer, trans, and two-spirit communities, both in like group settings as people supported each other, and as like a counselor just witnessing people's healing journeys. And I think that, you know, as many challenges as there were, I think a lot of people actually reached out for support for the first time, or maybe realized that maybe they had an issue that they needed help with for the first time, because the, you know, COVID restrictions and all those types of things were isolating them to the fact where they could no longer not address it. So I guess that's just kind of one of the silver linings and one of the ways that I've noticed a lot of strength in the community. And then I'll just do a quick shout out. It gave me an opportunity to just try and fill a gap. So I'm just grateful that I was able to kind of start a new group that was geared towards people who wanted to talk about substance use and how it overlaps with sexuality and gender. And that's gotten some good uptake recently, and I feel really excited about that group. So
congrats on getting that off the ground, Gwen, and thanks for all your really thoughtful reflections. I just want to give everyone a chance to respond to what was just shared in that first round.
So if I may, I think hearing all of this kind of really wonderful momentum has me reflecting on the really justified anger that I hear coming from disabled communities about like, well, what took so long? And like, we've been asking for these alternative modes of connecting and connecting with each other and connecting with resources like for a long time. And now that there was kind of this like forced momentum towards alternatives because of the pandemic, it's happened in a way that has been really deeply impactful for a lot of people. And so I'm just thinking about like the need to keep this going, and that like now that things are opening up again, we need not create insular, urban specific, only in-person networks, and just trying to think ahead to what it will look like to keep doing this work and to not revert back to where we were before. That wasn't working for disabled people, wasn't working for folks who live in rural and remote communities, wasn't working even for those of us who have relative privilege, who live in like deeply densely packed urban spaces. I know I don't want to go back into an office where I have, 20-person meetings where everyone travels into this one desk that we all sit around for an hour. Like even an opportunity like this to speak virtually with all of you, even if some of us are, a street down from one another, feels like something we ought to keep up as we kind of look ahead to what at least a post-pandemic Canada will look like, recognizing the rest of the world is not where we are.
Thank you so much for saying that, AJ. It did occur to me as all of you were speaking that a constant theme here is one of access. So there were many barriers, including for folks who are disabled, folks who are living in rural communities, trans and two-spirit and queer folks. Just because we had an excuse for most services and institutions to move online during the pandemic doesn't mean that we should forget that actually the barriers continue and are multiple, and maybe there's an opportunity in going forward in keeping our eye to that as we grow and expand our programs. I want to shift gears now to the second part of our discussion, and I'll just share two reflections from my own experience. So when I started doing work in queer communities 20 years ago, it was in the context of seeing a lot of my friends, lovers, people around me living with HIV, and really successfully pulling together community resources, things like social events, educational events, HIV testing, and HIV care. And it's something that I see as a really proud, if I can say that, kind of legacy in queer communities, that we have found ways, despite hardships, to come together and support one another. This last 18 months, I've also had the opportunity to watch and learn from survivors of so-called conversion therapy who have successfully brought about a proposed bill, Bill C6, to ban these practices in Canada. And again, I was struck that that movement came not from our government, not from larger institutions, but from survivors of conversion therapy themselves, who had to speak out again and again and again until finally people would take action. And so the common thread kind of bookending my trans, queer, and two-spirit experiences so far is that it's two-spirit, trans, and queer people who are actually really carrying a lot of the burden and a lot of the work over and over again. And it's a source of pride, it's a source of resilience, but it strikes me, and I had this feeling when I was watching the Justice Committee, the House of Commons, debate this bill, who are predominantly cisgender and heterosexual, scratch their heads and wonder, oh, geez, we didn't know this is happening. Maybe we should have been doing something sooner. So what are those issues where, and those actions where I think cisgender heterosexual people who are watching this video, who are thinking it's Pride Month, maybe I can start to examine my own position as a heterosexual cisgender person, what would we like them to do? And what cues would we like them to take from some of the powerful stories and actions you've all shared? So that's going to be the second part of our discussion. And here's our opportunity to really put out some challenges and some big ideas to our cis-het allies at SFU and beyond. So let's stick with the same order, though. If someone feels energized, feel free to jump in. So we'll start with you, AJ.
Thanks, Travis. So I think mine is a call both to cis-het allies who are doing this kind of education work, and also maybe a call into myself that is to include and foreground positive narratives in addition to the kind of deficit-based ones. So I do a lot of training with healthcare providers, and I'll create these like problem-based fictionalized scenarios where I take a fictionalized queer or trans person and I put them in a healthcare setting where everything that could go wrong could possibly go wrong. And we kind of reflect on like, well, why did this happen and how would we change it? And I had someone at a recent training say, like, could you do one strength-based scenario where everything goes right? And it just has me thinking about the potential harms if we only tell stories of hardship. That like, yes, queer and trans lives do involve negative health outcomes and increased rates of violence and barriers to healthcare and family challenges and struggles. And like, these things are true, and I don't want to diminish their truth and like the deep impacts that they have on people's lives. But I worry if that's the only story that's being told. I worry about that for cis and het people who might have very limited exposure to queer and trans lives. And I worry about it for people who are maybe questioning their identities and are seeing nothing but bad news about what it will look like if they are queer or trans themselves. And so I want to hear more stories of like joy and euphoria and community and connection, and stories of people even just living mundane lives where like it's just kind of like, yeah, we go to the grocery store, yeah, it's fine. And yeah, just kind of recognizing the power of positive stories as well, kind of speaking back to this like need for, like, we have a need for resilience because of hardships, but using the language of Berlant, if I could be academic for a moment, thinking about slow death, that like, I don't want queer and trans lives to become so entangled with hardship that it becomes a defining characteristic of our existence. And so just calling in myself and cis-het allies who are educating each other to tell stories of joy too, because I love being trans and I wouldn't change it for the world.
Thank you so much. I think that's such an important point. And it occurs to me as I listen or even reflect on my own coming out experience that sometimes the negative reactions from cis and het parents and caregivers and teachers has to do with their fear of all of these negative things that could happen to you because you're trans, because you're queer, two-spirit. And I think what you're offering as an action, AJ, is a really powerful antidote to say, actually, trans lives are beautiful, and there are things that we need to contend with that are serious societal problems, and there is something ahead for you that is really exciting and beautiful and make sure those stories reach people at that time when they're trying to figure out their identity. Okay, so Jay, what do you think Two-Spirit trans queer people can teach the cis-het majority, and what are some actions or supports they should take?
For me personally, I think what cis-het folks can learn from our community is the beauty and the unique perspectives of our community, particularly Two-Spirit people. As pre-contact, prior to colonization, Two-Spirit people who have various names in different languages and different nations. And this is kind of like that community gathering term that kind of was created in the 90s and early 2000s. But we had a lot of really important roles. We were seen as peacekeepers, healers, knowledge keepers, fire holders. We had a lot of very important cultural and spiritual roles and honored genders. And for anyone who doesn't know, Two-Spirit people are Indigenous people who embody diverse or non-normative sexualities, genders, and gender expressions. And it's not quite synonymous with Indigenous LGBTQ, but is often used as an umbrella term. And I think the beauty of Two-Spirit people being able to bring communities together and having the ability to see different perspectives simultaneously has been a great unique strength of Indigenous peoples. And also I think because of that ability to see from multiple perspectives, because of our diverse genders, we can also embrace the concept of eduapmuka, which is the Mi'kmaq word for two-eyed seeing, which is coined by an elder in Mi'kmaqi. And the ability to combine Western and Indigenous perspectives is really important in modern day reconciliation and decolonization, and be able to integrate those two together. And I think the ability of Two-Spirit people to see multiple unique perspectives is a great strength to do that. And so I think the actions I would call on for cis-het allies is to, kind of like what AJ says, not focus on our deficits. We are resilient. We have stuck it through 100 years of oppression and colonization and genocidal attacks on our gender and our communities. And we're still here, and we're reconnecting, and we're relearning our place in our communities despite the onslaught from colonization. And we know when you focus on the strengths of Two-Spirit queer and trans communities, when you focus on programs that connect you to community, that connect you to culture, that it improves the health of Two-Spirit folks, and as well as Indigenous folks at large. And instead of focusing on what's wrong with the current state and focusing on like how can we make it better, is really important. And also, I think the medical education system needs the cis-het allies to do more of this work. As the token Two-Spirit person in most spaces, I feel very pressured to do a lot of this work. And the cis-het allies need to take on that work to do the organizing, to hire the people and get people paid labor to do the educating, and not force it onto the Two-Spirit queer and trans trainees that they have in their programs.
Thank you so much, Jay. And as you're speaking, I'm reflecting that, we are talking today about intersectional identities, including Two-Spirit and Indigiqueer identities. And so maybe a reframing of my question is not only what can our cis-het allies do to support and really advance the spaces for queer, trans, and Two-Spirit people, but also what can I and other queer settlers do to make space for Two-Spirit people to reconnect with those pre-colonial roles and traditions, acknowledging that part of reconciliation is accounting for how colonization, yes, stripped Indigenous people of attachments to culture, but also to these pre-colonial gender roles. And I think that's something that I have to think about very carefully, and I hope all of us are thinking about a lot, not just during Indigenous History Month, throughout the year. Milo, would you like to chime in with some lessons for our cis-het pals?
Sure. Yeah, I guess a story popped to mind when I heard this combination of questions, what do we have to teach the majority, and also what kind of actions can allies be undertaking? And in my work, actually a big part of what I do, like I have this hat where I work in community, right, with gender diverse, trans, two-spirit, intersex people. But another huge part of my work is community education and kind of trying to be massaging larger geographic areas into like having more supports just kind of built in. And when I first took on this position, it was about 3 or 4 years ago, I think I had this thought in the back of my mind, like, oh, I wonder if doing Trans 101 is going to get boring. And it so hasn't, because what I've really found, I've learned so much about allyship from being able to teach and learn from people that I'm talking to. And what I found is that a lot of what we, the LGBTQ and two-spirit people community, are asking of allies is like this two-sided coin of like humility, right? Listening, those things that go with that. But then also confidence and fluency, right? And so often people will come in to a workshop because they're feeling anxious, and they're sitting down and they're wanting to like really prescriptively they want me to give them all these dictionary definitions of terms and like, what does this mean? What does that mean? And we kind of discover together often like what is more foundational is a comfort that comes with confidence of just being able to talk about lesbian, gay, bisexual, queer, trans, two-spirit identities, right? And often what I'm noticing when people are asking, well, I've heard about gender fluid and I've heard about asexual and I've heard about, right? And they start asking like at the edges. And I'll kind of get to ground with people and say like, cool, well, let's focus first on like what you're feeling more comfortable with. Let's talk about gay, right? How do you talk about gayness to your friends, to your kids, and let's start in your comfort zone and kind of expand out. And often, and I get to experience that too when I'm talking about intersex identities and two-spirit identities and asexual identities, other identities that I don't hold. And I get to feel into that humility piece, right? Of knowing who are the two-spirit youth workers in my community that I can connect someone to that is just more comfortable and appropriate for them to be having this specific conversation with. But also not to shy away from talking about it, not to say, oh, well, it's not my experience, so I can't talk about it, right? Like having the confidence to actually step into the voice that I'm given and do good by it, right? And so it sounds basic, but I would say like audit audit your own fluency and practice conversations, and then look around at your workplace, your organizations that you're involved in, and think like, what is the LGBTQ experience of walking into this space that I might not know, and what are the changes that would be relevant, right? And some of my favorite workshops I get to do are with organizations that you wouldn't necessarily think would prioritize having like a queer competency training. Like I've got to talk to acupuncture clinics, and I've got to talk to like cannabis clipping teams and like various different people, because like people in leadership there have been like, you know what, this is actually an important conversation for our workplace. And I think that the conversation is foundational. And that's what I got.
That's great. Thank you. And I imagine in any community, and maybe in particular in some of the communities that you're working in, Milo, the very first conversation that someone who is 2SLGBTQ may have is with someone who's cis-het. And so if they're shy or uncomfortable about the conversation, that's going to be one more barrier for that person to find themselves. Okay, now we'll hear from Anoop.
I'm not sure I have too much to add because everybody before me was so eloquent. If there was anything that I could tell our cis hetero communities is acknowledge that we have been thought leaders about many conversations that have been had in that community that we actually were pioneers around. We were talking about diversity and inclusion way before it became DEI in your workplace. We were talking about white supremacy far before you were talking about it on social media. We had been having conversations around intersectionality and how that shows up in service access way before. We had been thinking about the feminist lens and how it is ever changing and encompassing and holding more people to our, femininity as that shows up far before it was, Instagram pictures. and so acknowledge that thought leadership, social justice, advocacy hasn't come from a cis hetero-centered space. And that part of that acknowledgement and kudos needs to go to our queer, true spirit, Indigenous communities for showing the diversity and cultures and communities are value adds to people's lives. And I sometimes feel a bit sad for them to now be a part of our work cultures and communities where we have been trying to honor that for quite a bit of time. In terms of what I can ask is, one in very particular is decriminalize sex work. So if there's a petition, sign it. Go to a store, buy the shirt. Send the appropriate resources to that, talk about it. Because the safeties associated with sex work are very much synonymous with cis hetero communities and not to our, sisters and Indigenous communities, trans women that are disproportionately impacted by the lack of safety associated with it. So put your name to the paper and sign that petition or show up. And lastly is, listen to the podcast that you Google. Act responsibly as social beings in accessing social media. Ask, you can Google things and podcast things. Now, knowledge is very diverse and on many different platforms. So take on the labor of educating yourself.
Thank you, Anoop. And I think I would add, as you're crediting 2SLGBTQ communities and having led and advanced a lot of that anti-oppression work, I think it was in particular people of color, Black, Indigenous, queer, and trans and two-spirit people who are leading the charge in those spaces for a long time. So just want to just acknowledge and credit that intersectional leadership that has been so important for our communities. Brittany, your turn to comment on our lessons to share, actions and recommendations for the larger cis-het society.
The first thing that's coming to mind, besides all the wonderful things that have already been said, is this mindfulness of language and how important language is, not only in Indigenous communities and other diverse cultures, but how we treat each other, how we engage with one another. We always think that we need to have these, big activism moments as well, where, you're stomping down the streets, maybe in pride colors or all decked out, where activism can actually be really small. And just once again, tying it back to that language piece of correcting people when they're making discriminatory comments. Obviously, when it's safe to do so, and there's very different environments where maybe that is a place to do so, but there's a lot of side chatter that can be extremely discriminating towards other people who don't fit the cisgender het framework or white framework. So yeah, just something like just being mindful of that. When it comes to language too, like the simple thing of putting your pronouns in your email, your Zoom ID, acknowledging it in your email address, and being mindful with the questions that we're asking our two-spirit, queer and trans people. Just because you may not understand something doesn't also mean that you have the right to know, why they express themselves a certain way or behave a certain way or choose to be with someone and for a certain reason. So yes, we're curious human beings. We want to learn more, and we think we're doing the right thing by you asking these questions. But some of the questions, maybe ask yourself, would I be offended if this question was asked to me? Would that personally offend me in some way? Or, utilize resources before asking these questions. And that kind of ties into that self-education piece. A lot of, two-spirit, queer and trans people, we want to have these conversations, but it can also be cause a lot of emotional labor that ties into that, and reiterating and, correcting people over and over again. Yeah, it just the last kind of comment I want to make is, you know, for our cisgender and heterosexual allies, of that internal reflection of how you have gained privilege or been successful from the systems that are in place. You know, we once again, going back to the self-education piece, we want other people to teach us. We don't take on that ownership and that responsibility for ourselves to, you know, research and teach ourselves. So just those personal reflections and the environments that you grew up on of how that's all connected to your worldview. Thanks.
Thank you so much. And it reminds me of what Milo was sharing earlier about that need to get into a space of humility and you know, appreciation of where we are and what we have. Over to you, Gwen.
Thanks. Yeah, just wanted to say, you know, before the end that I'm just completely honored to be able to share this space with everybody and grateful for the opportunity. So thanks for letting me be here. Everybody else always said awesome things. I guess what was coming to mind while everybody was talking was just kind of like this idea of like putting our money where our mouth is. I think that we saw how quickly governments can react, you know, over the past year and a half when things are serious. And so I just like, you know, how can we interact in our own sphere of influence to really take, you know, collective liberation as kind of like our goal and really take some actions. In my limited experience giving, you know, some sort of allyship advice, what I've gotten from people and what I try to practice myself is like, allyship isn't an identity that you give yourself. It's a verb, it's an action. It's like friendship. And so it's really something that I myself am trying to do as well with other, you know, communities when I try to support and show solidarity. And so just kind of, you know, not just putting, not just like practicing putting things up during Pride, but we're really just focused in our own sphere of influence. And then just this idea of like intention versus impact is something that I'm also trying to practice a lot in my own work and in my own life. But I think that it's important for us to just self-reflect, to say, okay, I know what my intentions are, but what are actually the outcomes that are coming in my work or in my, you know, relationships and things, and am I really having the impact that I want to have in my life? And then the last thing that I'll randomly, this is just random and it doesn't matter as much, all that other stuff was way better, but like when it comes to research, I think more money needs to be put into implementation science instead of like, I mean, I'm so sick of hearing that HIV is a problem within the gay, bi, queer men's community, like, or within trans and indigenous communities. And it's like, we already know these things. Now, how can we take research funds and use it to, you know, uplift these communities and provide them with some resources that they need in order to help provide services and access and develop all of these awesome things that we're researching and we're knowing about, we're developing. Let's just move that money into implementation. So anyway, that's my soapbox. I'll get down off of it now. But
Thanks, Gwen. We love you on your soapbox. I'm gonna give Milo the chance to add some last thoughts, and then I'll wrap things up with a few suggestions of my own for actions our viewers can take. Milo?
Thank you. Yeah, I was just listening to everyone speaking after me, and I was like being politicized by all of you as we speak. And I just wanted to add one more huge piece of work that Anchors does, the organization that my program is through, is harm reduction, right? And you know, in my own programming, I've definitely seen over the past year, you know, we've lost way more people to the opioid epidemic than to the COVID pandemic in my experience in my local area. And if you can support safer supply initiatives that are happening across the province, they make a huge difference. And we've seen a huge impact, positive impact locally. And let's just throw housing in there too. Everyone needs a place to live. Safer supply is a human right. Let's get it going.
Thank you, Milo. I couldn't agree more. I think what I'm hearing from everyone is a call for not just limited Pride Month action on the part of allies, but actually consistent dedication to Two-Spirit, trans, and queer people in their lives and beyond, but also to intersectional and intersectoral action for things like implementation research, things like a safe drug supply, things like harm reduction, access to abortion. I mean, all of these issues in intersectional ways affect us as queer and trans and Two-Spirit people. Before I thank our panel, I just want to mention two pieces of action that you might want to take. One is if you're inspired by this discussion and you have something that you would like to share or contribute, be a part of a network. We have the Roundtable meeting every 3 months. Our next meeting is on July 9th, and you can contact me if you'd like to be included in our distribution list. We have over 80 members, and it's a really vibrant space for sharing resources and activities that we're doing within our communities. And if you're not sure where to start, we have a website called MindMap BC. You can Google it, MindMap BC. And this is a database of low barrier accessible mental health and social support services and substance use services throughout the province. Many of the ones that were mentioned today are indexed on that site. And we've really taken care to, in particular, include services that have worked to create an affirming environment for Two-Spirit, queer, and trans people. So that's something that you can offer to the people in your life. And finally, I just want to say it's such an honor to be with the six of you. I really mean it when I say I'm inspired to do this work because of all of the love and energy and critical thought you put into this. You are absolutely angelic troublemakers, and for that, I am very grateful. So thanks for being here, and happy Pride Month.